Hi friends, today's our topic is menopause. Menopause is the end of menstruation. The word menopause comes from a Greek word mens and poses. Mens means monthly and poses means cessation. Menopause is the natural aging process of a woman. So hereafter her ovaries are not producing sufficient estrogen and progesterone in order to support her reproductive cycle. After menopause, she is no longer able to get pregnant. We'll start the section with the definition of menopause. Menopause is the permanent cessation of menstruation at the end of the reproductive life due to loss of follicular activity. Here I will discuss about the phases of menopause. The menopause has 4 phases. The first phase we called it as premenopausal phase. The second one is perimenopausal phase. The third one is menopausal phase and last one is postmenopausal phase. We will see one by one. The first one is premenopausal period. So that means the period prior to the menopause. Usually it starts at the age of 40. Next one is perimenopausal stage. That means here there are few physiological and hormonal changes will happen in a woman in order to complete the menopause. So that period we called it as perimenopausal phase. So next one is menopausal phase. So here the woman completely attained the menopause. So she is not having any monthly cycle. Usually the age ranges between 45 to 55 and the average age will be 50. The last one is postmenopausal period. So here the coming 1 year, so once the woman attain menopause, the coming 1 year we consider it as a postmenopausal period. So during this 1 year she is not getting any consecutive monthly periods. So that is about the phases of menopause. Before moving to further, I would like to explain 2 abnormal menopausal conditions, that is premature menopause and delayed menopause. Here in case of premature menopause, the woman attain menopause before the age of 40. That is called premature menopause. This can be occurs due to some premature ovarian failure. So here in case of delayed menopause, the woman attain her menopause after the age of 55 years. Next we will discuss about the causes of menopause. The main causes of menopause will be the depletion of estrogen and progesterone. Once there is no sufficient amount of estrogen and progesterone, the egg will not be released from the ovary. And also when I took the class in the oogenesis, I already explained the oogenesis start from the intrauterine life itself. So once the baby girl inside the uterus, the number of egg will be determined. Once she attains the puberty, every month there will be a release of egg. So the total number of eggs are released completely. So further there is no ovulation and which can lead to menopause. Other etiological factors include natural decline of reproductive hormone, hysterectomy, chemotherapy and radiation therapy. These cancer therapies can induce menopause causing symptoms such as hot flashes during or shortly after the course of treatment. Next etiology will be primary ovarian insufficiency and last one is removal of ovaries. So these are the etiological factors lead to menopause. Next we can discuss about few symptoms of menopause. The few symptoms are hot flashes, vaginal dryness, sleep disturbances, new onset of depression, cognitive changes especially memory loss, changes in sexual function, joint pain, menstrual migraines and breast pains. Usually in the perimenopausal phases, the woman can experience some kind of irregular periods. These irregular periods are shorter periods, longer periods, extremely light periods, extremely heavy periods, skipped or missed periods. These irregular periods are the symptoms of perimenopausal stage. First, we'll discuss about the vaginal dryness. Usually the woman experience vaginal dryness after the menopause. This can be occurs due to the depletion of estrogen hormone. Next symptom is hot flash. So usually women experience hot flash throughout her menopausal life. Here the woman experience intense heat, sweating along with the increased heartbeat. This condition will be intolerable to woman, but it can fade within a second. The woman experience night sweating and sleep disturbances. This will be a usual problem for every woman after attaining menopause. This can be due to the disturbed hormonal activity. During menopause, the production of sex hormones will be disturbed. Because of that, she experiences loss of libido. Apart from that, she experiences some mood disturbances also. These include sudden bouts of sadness and inability to concentrate, lack of motivation, irrational anger, and increased fatigue. Usually during menopausal period, the woman gain the body weight. This can be due to the increased level of androgen in her blood. Most of the women experience thinning of the hair and hair loss along with dryness of the skin also. Next we'll move on to the test and diagnostic aspect of menopause. Usually it is not necessary to go for any diagnostic evaluation in order to confirm the menopause. Once the woman cross the age of 55 years, if she is not getting any regular period for the 1 year, it is confirmed already she attained menopause. If it is necessary, she can go for some hormonal investigations, especially follicle stimulating hormone, estradiol, thyroid hormone, all those things. There will be variation in her blood, so which can confirm she is already attained menopause. Next we'll move on to the treatment. So first we'll discuss about non-hormonal treatment. There are variety of menopausal treatment, both natural and medical, that can alleviate the symptom of menopause. Dressing in light layers can alleviate hot flashes and night sweats. Avoid caffeine, alcohol and spicy food can also minimize these symptoms. Menopause and weight gain tend to go together due to lifestyle changes than to the hormonal changes. Reducing dietary fat intake and regular exercise helps to combat weight gain during menopause. Menopause can lead to osteoporosis. Calcium, magnesium and vitamin D can help restore bone density, which naturally deteriorate after the age of 30 due to reduced estrogen level. Menopause decreases vaginal elasticity, leading to vaginal dryness. Vitamin E can help, as can Kegel exercise, which helps restore elasticity. Using water-based lubricants during sexual intercourse also minimizes discomfort related to vaginal dryness. Menopause often leads to dry, itchy skin and weak, thin hair that break and that has lots of split ends. Flaxseed oil can help restore her hair and skin healthy appearance, as can vitamin E. Low dose of antidepressant also help. Certain antidepressant related to class of drug called selective serotonin reuptake inhibitors may decrease menopausal hot flashes. A low dose antidepressant for management of hot flash may be useful for women who can't take estrogen for a healthy reason or women who need an antidepressant for a mood disorder. Gabapentin also can be helpful. Gabapentin is an approved to treat seizures, but it has also been shown to help reduce hot flashes. This drug is useful in women who can't use estrogen therapy and in those also have migraines. Next we'll move on to the hormone replacement therapy. It is indicated in menopausal women to overcome the short-term and long-term consequences of estrogen deficiency. It can be administered orally or transdermally in the form of patch because it replaces female hormone produced by the ovaries. Hormone replacement therapy minimizes menopausal symptoms. It can be used before, during, and after menopause. In that, we can discuss about estrogen and progesterone replacement therapy. The most common type of hormone replacement therapy involves both estrogen and progesterone. More than 8 million women are currently taking combination of hormone replacement therapy, and it is designed specially for women who have a uterus. During this therapy, estrogen is given regularly while progesterone is added in a supplement basis. These two hormones are given in combination in order to prevent the overgrowth of uterine lining. Estrogen alone may irritate this lining, which could lead to endometrial cancer. We can use estrogen only. Estrogen therapy alone is usually given to women who have lost their uterus due to surgical menopause. Because no uterus is present, the need for progesterone is not as great. Next is progestin only therapy. Progestin only therapy is not prescribed very often. Progestin does seems to provide excellent relief for women plagued with hot flashes. Here we reach the end of our today's section. In this video, I explained what you mean by menopause, different phases of menopause, causes of menopause, few menopausal symptoms, and various treatment modalities. The nursing management related to menopause will be displayed on the screen. Please have a look on it. So in the next class, we will meet with another episode of midwifery topic. Till that, take care. Bye bye.